What is up, everyone out there on YouTube? Welcome in, it's Austin here. So today we're going to be talking about the vasculature of the upper limb. So enter in with me, here we go. Okay everyone, y'all ready for this? So, after that dramatic entrance into the video, we're gonna start discussing with the subclavian artery. Remember, this is coming off of, this is the right limb is what we're talking about, right side. So this is coming off of our right brachiocephalic trunk, which comes off of the aortic arch. And comment down below if y'all have anything to add or correct me on, because we're learning this together. So you have your brachiocephalic trunk, and then off of that, you will have the common carotid, the right common carotid artery, and the right subclavian artery, and those will branch off of that brachiocephalic trunk. And that's where we start the video, is with the subclavian artery. We're not going to care about the carotid because that's going up to the neck. We're talking about the limb here. So we start off with our subclavian artery, and the simplest path of blood flow going down the limb is subclavian to axillary artery to brachial artery, and then you have a deep brachial artery, right? But blood vessels can get blocked. Sometimes they have to be tied off. Sometimes they can get a stent put in them as well. But imagine like a stab wound and someone's bleeding out and they have to tie off a blood vessel, which is going to cut blood flow off. Where do you want to tie this off so you don't lose blood flow to the whole entire limb, right? Because there's collateral blood flow, which we're going to talk about, to bypass occlusions, which is important. Really cool things our body has done is, you know, if we have a blockage somewhere, there's areas where sometimes we can bypass this blockage. There's three sections of the axillary artery, 1, 2, and 3, okay? And what's cool about these is the pectoralis minor muscle is kind of what highlights the third, second, first section, but also the first section has one branch off of it, superior thoracic artery. The second section has two branches off of it, the thoracoacromial artery and the lateral thoracic artery. The third branch has three branches off it, so it makes it easy. Anterior circumflex humeral artery, posterior circumflex humeral artery, and subscapular artery. So 6 different arteries branching off the axillary artery in these 3 sections. So let's talk about let's talk about some, like if there's a blockage somewhere, right? Let's say there's the surgeon had to tie off, you know, there was a bleed and the surgeon had to tie off this axillary artery right here at this second portion. So basically in this space. What route could blood take to get around this blockage to feed the lower limb? Okay, so if this is tied off, yo, I just got a bad mosquito bite on my leg. Ow. That's what happens when you live in Louisiana. You get a lot of mosquitoes. So yeah, if this number 2's tied off, you can't get blood down here. But look at this. Look at this. So coming off of your thyrocervical trunk or thyrocervical artery, there's different names. Sometimes these are called different things. And another thing is people have variant anatomy, so it's not always going to look like this. In fact, the dorsal scapular artery, which is going to be Yo, I'm in the middle of my video and it just abruptly cut off, so let's continue. Okay, so now we're going to discuss the rest of this. So, had a little minor difficulty there. So we're going to primarily focus on the dorsal scapular artery because it is very important to form this collateral blood flow across the axillary artery. So as we said, the psoas minor muscle is going to, not the psoas minor, the pectoralis minor muscle is going to delineate these portions of our axillary artery, number 1, 2, and 3. And I think we discussed all that already. So let's talk about the different portions here. So we have our thyrocervical trunk, transverse cervical artery, and then this dorsal scapular artery and suprascapular artery. So let's assume like the patient gets stabbed in the upper right chest and he's bleeding, and the doctor, I mean, they could, I guess, put a stent in the vessel, but they might tie the vessel. If you tie the vessel off right here, how are you going to get blood down the rest of the upper limb? Well, you have this dorsal scapular artery. So that's important. And we're also going to discuss the suprascapular artery, which can also get around this as well. But so let's just go with that scenario. This is tied off right here at number 2. Okay. If it's tied off at number 2, blood can't go down here. So how's blood going to get down here? Well, we're going to take this dorsal scapular artery, and it's important to know that the dorsal scapular artery, people have variant anatomy, so it's not always going to be the same in every person. But this, 75% of people, it comes off of the subclavian artery. 25% of people, it comes off of the transverse cervical artery, which comes off of the thyrocervical trunk. There's a thyroid branch off of here and cervical branch, so that's why this is called the thyrocervical trunk. So you'll see either blood flowing from subclavian to dorsal scapular, or subclavian to thyrocervical trunk to transverse cervical artery to dorsal scapular. And then once you do that, now, and that's what I've written up here, it can come from both these branches, thyrocervical to transverse or subclavian. Once you get here, we have the circumflex scapular artery. Circumflex, I think, just means like go around something, and this is around the scapula, and this is on top or to the side of the scapula, I believe, like medial into the scapula. Then it connects with the circumflex scapular artery, and then that will also have 2 branches. You have a thoracodorsal branch here, which we don't care about, and then we'll have a subscapular branch. And that subscapular branch ties directly into the 3rd portion of the axillary artery. So that's how we can bypass it. If there's a blockage here or tied off, we can get blood down the limb through this route. So dorsal scapular, circumflex scapular, subscapular. Now, let's see what else we have. Another route, suprascapular artery. Let's talk about that one. We can see it up here. Also, this comes off a thyrocervical trunk. Suprascapular artery goes above the scapula, supra. There's an acromial branch that goes over the acromion, which then can tie into the posterior circumflex humeral artery, which we see right here. And this basically goes around the neck of the humerus, along with the anterior circumflex humeral artery. They both connect with each other, but there's this branch that goes upward off of the posterior branch of the circumflex humeral, and that can combine with this acromial branch of suprascapular to form this junction. So basically, you can also go suprascapular to acromial branch of suprascapular to posterior circumflex humeral artery, which drains directly into the 3rd portion. So this 3rd portion is very important. Now let's say we actually blocked off the 3rd portion. There's a way this lateral like if this is blocked off, but this is open, you can get blood in here and here. So this thoracoacromial artery has an acromial branch as well, and actually has 4 branches: a pectoral branch, a clavicular branch, a acromial branch, and another branch. It might be, I don't know the other branch, y'all. Maybe thoracic branch, I don't know. Anyways, this goes up to the acromion, and it can also join with the acromial branch of the suprascapular artery, which then can drain into posterior circumflex humeral artery. So you can get blood from here as well. And this can also, this system here, once you get to this acromial branch of suprascapular artery, remember you can also go, this will also connect, I believe, with the circumflex scapular artery and can drain into subscapular artery, but that's not that important to know, I don't think. So basically, there's different things here. Let's say we have to, like, you know, we tie something off. Someone needs something, the vessel tied off because there's bleeding. If you tie it off below the deep brachial artery, profundus brachii, if you tie it off below this, like right here, you're safe because blood can flow down this collateral vessel and get blood to the upper limb. But if you tie it off above the deep brachial artery, so let's say you tie it off from subscapular down anywhere, subscapular to deep brachial, right? Then you can't get blood going down there, so that's a problem. So you don't want to tie it off subscapular and below, but you can tie it off below the deep brachial. You can tie it off between even, you know, tie it off between thyrocervical and really any of these areas can be tied off. Thyrocervical and thoracoacromial, you can tie it off, you'll be fine, because you still can get blood to thyrocervical, and then, but thyrocervical to suprascapular, or thyrocervical to transverse cervical to dorsal scapular. Again though, this comes off of subclavian in 75% of people. So if you tie it off to proximal or before the dorsal scapular branch, then this will be occluded as well and won't get blood. So just some things to think about, things to consider. This video's gone on way longer than I expected. But the point of this video is dorsal scapular artery forms a nice segue to get past the second and the first branch or portion segment, first, second segment of the axillary artery. And also suprascapular artery as well can go on top of the scapula. It has an acromial branch which can join with posterior circumflex humeral artery and drain as well. So this third segment of axillary artery has two important connections. It has three connections, but two are important: the posterior circumflex humeral artery and the subscapular artery, because they both can gather blood from up here to bypass any kind of occlusions. And I think that's the video, y'all. So I appreciate everyone who has watched it. Go out there and make someone's day better today. And God bless y'all. I'm out. We're going to be what? Great doctors. We're going to be great doctors.